Good morning, everyone. Today, we will discuss a critical topic that holds great importance for all of us. Employees diagnosed with the COVID-19 and CDC quarantine policies for safe return to work. I'm Bincy Abraham from Maryville University, and I am excited to share this valuable information with you. In light of the ongoing pandemic, it's crucial for organizations to understand how to handle employees diagnosed with COVID-19 and adhere to CDC quarantine policies. Together, let's explore the guidelines that ensure a safe and smooth return to work for affected employees. My name is Bincy Abraham and I'm a registered nurse with a bachelor's and a master's degree in nursing. I completed my BSN at Bishop's College of Nursing in Dharapuram, Tamil Nadu, India. And I pursued my MSN and TNP at Maryville University in St. Louis, Missouri. Currently, I am proud to serve as a nurse practitioner specializing in employee occupational health at VA Healthcare System in Oklahoma City, Oklahoma. Today, I am pleased to present the esteemed members of my committee who will be guiding me through this important endeavor. My chair, Dr. Teresa Galactus, brings a wealth of knowledge with her impressive qualifications in PhD, DNP, MSW, MSN, and RN. She hails from Maryville University in St. Louis, Missouri. And I am fortunate to have Delphine Colo, a dedicated community person and nurse practitioner with BSN, PhD, and FNBBC credentials. She has been making a significant impact in ambulatory care at the VA Healthcare System in Oklahoma City, Oklahoma. Thank you so much for all the other DNP program faculty for valuable insights. As a nurse and researcher, I have witnessed the resilience and dedication of healthcare workers who bravely faced the COVID-19 pandemic on the front line. The International Council of Nurses reported that 10% of global COVID-19 cases were healthcare workers, with nurses representing 40% of that figure. In the US alone, from January 2022 to October 2021, over 440,000 healthcare workers were diagnosed with COVID-19. These frontline heroes not only cared for patients but also became patients themselves. The toll on their physical and emotional well-being cannot be understood. Today, I emphasize the importance of of recognizing these risk groups and promoting the well-being of our healthcare heroes, for healthcare is crucial to safeguarding the health of us all. Healthcare workers' well-being and safety during the COVID-19 pandemic care crucial for effective patient care and crisis management. To ensure their protection, we must re-evaluate adherence to infection prevention protocol, provide adequate PPE, and improve work conditions. Preventive strategies, education, and awareness initiatives are essential for a resilient healthcare workforce. Moreover, policymakers and organizations must focus on care, assistance, and stress reduction to prepare our healthcare professionals to handle ongoing crises. Together, let's prioritize the well-being of our frontline heroes and build a safer and stronger healthcare system. In my literature review, I explored crucial topics surrounding healthcare employees during the COVID-19 pandemic. Firstly, I examined cases of healthcare employees infected with COVID-19 to understand the challenges they faced. Next, I conducted chart reviews to gain insights into the impact of the pandemic on healthcare facilities and their workforce. Additionally, I investigated strategies to maintain a healthy healthcare workforce amidst the pandemic's ongoing challenges. Furthermore, I analyzed studies on the safe return to work protocols to ensure the well-being of healthcare professionals. Lastly, I dwelled in the importance of quarantine measures in preventing the spread of infection within healthcare settings. My DNP project aims to investigate the impact of CDC quarantine policies on the health and safe return to work of healthcare employees infected with the COVID-19. Specifically, I focused on the outcomes within the 5 days of quarantine. By analyzing this data, I sought to understand how these policies influence the well-being of healthcare workers and their ability to resume work safely and efficiently. My findings have the potential to inform future quarantine guidelines, contributing to the protection of our frontline heroes and the overall healthcare system. I shed light on the concerning impact of COVID-19 on our healthcare employees. They have been at the front line of this battle, but unfortunately, they have not been immune to its effects. The challenges faced by our healthcare heroes include a lack of access to personal protective equipment, vaccine hesitancy, staff shortages, and high exposure levels. As a result, many have contracted with virus themselves. Symptoms experienced by these dedicated individuals include coughing, fatigue, fever and chills, muscle aches, and changes in taste and smell, but the toll extends beyond physical health. Relentless demands of their work have led to high levels of workplace stress, depression, insomnia, poor quality of life, and emotional distress. Shockingly, some have even considered leaving their jobs. I emphasize the importance of rapid data sharing. Swift and effective sharing of infection data is crucial in understanding the outbreak's duration, mode of transmission, intensity, at risk groups, comorbid conditions, and management strategies. Why is this so essential? Because by maximizing the usefulness of the data, we can make informed decisions to combat the spread of the infection effectively. It enables us to identify vulnerable population, improve treatment protocols, and develop targeted preventive measures. A robust workforce is essential in our battle against COVID-19. Our key components include COVID-19 case notification, contact tracing, risk assessment, and daily symptoms observation. By investigating in health, we gain numerous advantages: improved well-being, decreased illness-related absences, and heightened dedication and job satisfaction. We should offer sufficient breaks, downtime, and psychological first aid through well-being centers. Well-being buddies foster a strong support system, reducing fear and anxiety while enhancing coping mechanisms and mental health. We have two essential points to consider. Firstly, for individuals who test positive but have mild to moderate symptoms or are asymptomatic, the isolation time has been reduced to 5 days. Following that, we ask that these individuals wear a mask in public indoor settings for an additional 5 days. This measure helps protect these around us and ensures a safer workplace environment. Secondly, we must strictly adhere to all other infection control measures. These include self-monitoring, temperature checks, maintaining hand hygiene, wearing appropriate personal protective equipment, practicing social distancing, and following stay-at-home, travel restrictions, and lockdown protocols. By implementing these measures diligently, we can create a safer and healthier workplace for everyone. Let's discuss the importance of quarantine in managing COVID-19 exposure. Quarantine is the process of isolating individuals who have been exposed to COVID-19, whether they have symptoms or not, from the general population. During quarantine, individuals can be isolated either in dedicated facilities or at home, depending on the situation. In the CDC currently recommended a 5-day quarantine period. After this time, if the individuals remain symptom-free, they can safely return to work. to provide an extra layer of protection. The CDC also suggests wearing a mask for an additional 5 days after the quarantine period's end. Quarantine is a crucial measure to prevent the spread of COVID-19, and by following these guidelines, we can help protect ourselves and our communities. Based on my DNP project, I adopted the trans-theoretical model of health behavior change model that helps in behavior change process. It occurs in 6 distinct stages: pre-contemplation, contemplation, preparation, action, maintenance, and termination, with the possibility of relapse. I found that the employee is free to switch between stages and even skip them entirely. The time duration of each stage can range from few hours to a lifetime depending on the intended change, the circumstances, and the individual. In my study, I used quantitative exploratory design, allowing me to delve into the subject with the precision and curiosity. Now, it is important to note that no human participants were involved. Instead, I conducted a retrospective chart review, extracting data from the electronic medical records of these dedicated healthcare workers. The setting for my study was an outpatient clinic, serving as an essential hub for my research. And when it came to sampling, I opted for convenient sampling, ensuring practicality and case of data collection. Presents our inclusion and exclusion criteria. To ensure the accuracy of my findings, I included healthcare employees who have been infected with the COVID-19. By focusing on the specific group, I could better understand the challenges they face and tailor appropriate support. On the other hand, I have carefully excluded records of employees who were not infected, those on extended leave, or those who resigned from the clinic. Doing so allows me to maintain a clear focus on the experiences of those directly affected by the virus. In my retrospective study, I used descriptive statistics to provide a comprehensive summary of my collected data. For nominal variables, I calculated frequencies and percentages to understand the distribution of different categories within each variable. On the other hand, for scale variables, I employed a measure of central tendencies such as the mean and median to identify the typical values, and measures of dispersion, including the range and standard deviation, and variance to understand the spread of data points. Gender distribution. In my study, 23 cases, that is 76.7% were females. In age distribution, I found that 19 participants were 40 years of age, that is 63.3%. Ethnicity, 40%, that is 12 participants were Caucasian. Occupation, I discovered that 24 participants were nurses, that is 80%. Timeline of infection, 43.3%, 13 participants contracted the virus in the year of 2022. COVID-19 severity, I found that 27 individuals experienced moderate symptoms. Reinfection history, 60%, that is 18 participants were reinfected. Comorbidities, 16.7%, that is 5 participants had diabetes. 10%, that is 3 participants had hypertension. 10%, that is 3 participants had triple comorbidities. Lifestyle factors, 20%, that is 6 participants were smokers. 46.7, that is 14 participants reported alcohol consumption. Quarantine duration, 50%, that is 15 participants underwent a 5-day quarantine. Vaccination status 60%, that is 18 participants were fully vaccinated. Interpretation. Discrepancy in gender distribution among healthcare employees. The data shows that there is a discrepancy in the gender distribution among healthcare employees. This could be due to various factors such as higher proportion of one gender overrepresented in the healthcare field of potential sample bias. Further investigation is needed to understand the underlying reasons behind this observation. High reinfection rate possibly due to new virus variants. The data indicates a high reinfection rate among the study participants. This could be attributed to the emergence of new virus variants that might be escaping immunity conferred by previous infections or vaccinations. As the virus mutates, it can develop new characteristics that evade the immune response, leading to reinfection in some individuals. 90% of infected participants experience moderate severity of COVID-19 despite vaccination. An interesting finding from the data is that 90% of the infected participants experienced a moderate to severe of COVID-19 even though they were vaccinated. This suggests that they were still exposed to a high viral load, potentially from contact with a highly contagious variant of the virus. Vaccination can reduce the risk of severe illness and hospitalization, but breakthrough infections can still occur, especially with a more virulent virus strain. Comorbidities or pre-existing health conditions may increase the risk of infection or reinfection. Understanding this connection is vital to protect vulnerable individuals and improve public health measures. Moreover, studies suggest that smoking and alcoholism might influence the severity of infection in smokers and alcoholics respectively. This information highlights the importance of lifestyle choices and the need for targeted interventions. In conclusion, by recognizing and addressing these factors, we can better safeguard our communities and promote healthier lives. Firstly, retrospective chart reviews ensure privacy as they do not involve direct patient contact. This means we can analyze patient data while respecting their confidentiality. Secondly, the quantitative nature of these reviews allows us to perform objective data analysis. By identifying patterns and trends, we gain insights into the effectiveness of various treatments and interventions. Lastly, electronic medical records play a crucial role in this process. They provide us with rich and accurate information, making our research more reliable and informed. In conclusion, retrospective chart reviews are powerful facilitators for conducting meaningful research while upholding patient privacy. Firstly, data integrity is paramount. Accurate and complete EMR information is crucial as it directly impact the quality of our research results. Secondly, we must be mindful of limited generalizability. Over-presenting female nursing professionals may lead to biased conclusion, so we need to ensure our samples represent the entire population. Thirdly, retrospective chart reviews can present inherent inaccuracies due to missing variables. It is essential to acknowledge and address these limitations to improve research comprehensiveness. Lastly, we must remember that descriptive statistics only summarize data, they do not establish causality. We should be cautious when drawing conclusions and strive for robust methodologies to infer causation. Fear of COVID-19 transmission at work has left our healthcare workers uncertain about return to work policies. This anxiety not only affects their mental well-being but also impact their job performance, creating a concerning ripple effect. Moreover, the stigma against infected COVID, the healthcare workers has exacerbated the situation. Tense dynamics and reduced motivation emerged, pushing some to return prematurely and downplay symptoms, risking not only their safety but also that of their colleagues and patients. Firstly, the retrospective nature of the study might introduce bias since researchers look back at past data which may not be fully accurate or reliable. Secondly, the reliance on electronic medical records can cause information bias. These records may lack certain details or contain errors that affect the study's integrity. Thirdly, the use of descriptive statistics in this study limits our ability to calculate effect size, which is crucial in understanding differences or effects between groups. Lastly, it's essential to be cautious when generalizing these findings to other populations or contexts. The specific sample used in the study might not represent broader demographic accurately. And this recent data has shown a concerning predominance of females, individuals over 40 in this workforce, raising questions about their exposure and vulnerabilities. High reinfection rates and moderate severity illness experienced by this group underscore the urgency for action. We must prioritize ongoing surveillance and in-depth research into disease cause factors. Equally important is the evaluation of long-term health impacts on our dedicated healthcare workers. To achieve these goals, future studies should consider larger and diverse sample, allowing us gain a comprehensive understanding of the situation. Additionally, we must examine correlation between job titles, ethnicity, and COVID-19 outcomes to address any disparities effectively. Furthermore, we cannot ignore the prevalence of lifestyle factors like smoking and alcohol use within healthcare settings. This emphasizes the pressing need for comprehensive health promotion and wellness programs for our healthcare workforce. As we reflect on the challenges faced, we recognize the pressing need for action to protect our frontline heroes and ensures the well-being of all healthcare workers. Firstly, it is essential to emphasize the provision of sufficient personal protective equipment and strict adherence to infection prevention protocols. This will safeguard our healthcare workers and patients alike. Secondly, addressing comorbidities among healthcare workers such as diabetes and hypertension is vital. Implementing preventive care strategies, regular healthcare checkups, and health education will help promote their overall well-being. Lastly, we must establish a specific policy on quarantine duration. Surprisingly, only 50% of participants adhered to a 5-day quarantine, contrasting CDC guidelines. Defining a clear and effective quarantine policy will protect the health of our workforce and prevent further spread of the virus. Firstly, the high prevalence of moderate severity illness among healthcare workers could lead to a potential staffing shortages, which may significantly affect the quality of care provided to patients. Secondly, the study discovered a relatively high frequency of alcohol use among healthcare workers, potentially indicating increased stress levels. This could have diverse effects on worker safety and in turn patient care. Lastly, the positive news is that a significant percentage of healthcare workers are fully vaccinated. However, it is essential to conduct further research on vaccine effectiveness in preventing severe disease and reinfections. On our top priority must be the well-being of our employees, especially our older workforce. I propose prioritizing them for vaccination and providing additional safeguards to ensure their safety. Healthcare employees are our heroes on the front line, and we must emphasize mental and physical health support for them. We shall reinforce infection control protocols such as proper use of personal protective equipment and hand hygiene to curb the spread of the virus. Monitoring reinfection cases and considering strategies like booster vaccinations will help us stay ahead of the virus. We must identify employees with underlying health conditions and implement risk management measures, including accommodation and modified work duties. Furthermore, let us focus on promoting healthy habits like smoking cessation programs and addiction support resources for a stronger workforce. To ensure a safe environment, we will continue to educate and address vaccine hesitancy, promoting the benefits and safety of COVID-19 vaccines. The alarming prevalence of reinfection among the fully vaccinated highlights the importance of ongoing surveillance and research into the effectiveness of vaccines against emerging virus variants. While our data provides valuable insights, it is crucial to conduct comprehensive research that takes into account factors such as socioeconomic status, healthcare access, and genetic predispositions. This will help us better understand the complexities surrounding reinfection and vaccine efficacy. In summary, continuous vigilance and investigation are vital to combat the evolving challenges posed by new virus variants. Let us remain committed to staying informed and proactive in our efforts to protect public health. References. Thank you for your time and attention, and I want to express my gratitude for joining me on this journey through my presentation. If you have any questions regarding the content discussed, please feel free to reach out to me via the email address provided. Thank you.